In this video, we're going to be going over how to assemble the XCP. First of all, let's go over the parts of the XCP. Well, they all have an arm, a ring, and a bite block. They come in colors: yellow, blue, and red. So the yellow is used to take periapicals or PAs of posterior teeth, which are molars and premolars. The blue is to take periapicals of anterior teeth, which are the teeth from canine to canine. And the bitewing is to take x-rays for us to check interproximally, in between the teeth of the posterior, molars and premolars. So let's start with the yellow. Always when we start assembling the XCP, we always have to hold the arm with our right hand. We hold it with our right hand, and the prongs that each one has, they have to be facing our left hand, because this is where we're going to be holding the bite block. So we're going to be holding the arm with our right and the bite block with our left. The bite block, as you can see, has holes on one side and on the other side. So we could use any holes, right? We could do it from here, from there. But as a rule, you always have to, when you hold the bite block, this area where the sensor goes always should be away from you, never facing you. So if by any chance when you are assembling it, this is facing you, you have to know that it's wrong, because this should never face you. So the first way that you should assemble it, if you're going to take an FMX, you always start with the upper right quadrant. So you're going to see that this bite block is facing up. So you should get this bite block to face up and away from you, where the sensor goes, not down, because this would be down. So if it's up, away from you, and the arm is on the right side, this assembly would be for upper right. Now we're only missing the ring. So for these singular rings and arms, we will always start with this hole. In the ring, you're going to have one side that looks like this, and the other side that has multiple holes that looks like this. So the one that you're going to use first in all of them is going to be this one, that it's the single hole. The way to position this is always where the bite block is, because you could use this hole and you could put it like this. However, the ring is not where the bite block is. And what's going to happen is when you expose the x-ray and you put the PID here, you're not going to expose the tooth that you want to. So it is very important that, yes, you're going to put the arm through this hole. However, the ring has to be facing the bite block. So you're going to put it sideways, and you're going to put it through this hole, and then you're going to check if this ring, you can see the bite block that's in the middle. Okay, so this is the assembly for upper right. The arm is on the right and the bite block is up, this is away from you. And again, you're going to start with this hole. You're going to put it through the arm there. So this assembly would be for upper right and the opposite quadrant, which is lower left. Now let's see it in the mouth. So this is the right side of the patient. So we're going to go to upper right, molars, upper right, premolars. Then we're going to take it out of the mouth and we're just going to flip it, putting it down so we can go to the opposite quadrant, which is lower left, molars, and then lower left, premolars. And that's the assembly for those two quadrants when you have it like this. Upper right. So now we got to change it and we have to go to upper left. However, we cannot leave it like this because if there is a cheek here, this arm is not going to let us, the cheek is not going to permit that arm to go in. So we're not going to be able to go in, or it's going to be sideways, which the x-ray is going to come out not good. So we got to do a switch here. So to do upper left, we're going to keep this looking up, and instead of the arm being on the right side, then we're going to move it to the left side. Now the arm is on my left hand. So it is upper left. But as you can see, that bite block is not in the center of the ring. So I have to change this. So the way to do it is, instead of going in through this hole, I'm going to take it out. I'm going to flip it so I can use these holes. And now I'm going to put it through here. And now it's in the center. So now this would be for upper left. And now let's try it in the mouth. This would be upper left, molars. Then we're going to slide it to upper left, premolars. Then we're going to take it out of the mouth and we're going to flip it to go down to the right side, lower right molars. Then slide it and we're going to take the lower right premolars. And that's how you would cover all of your posterior teeth. Okay? That's how you would assemble for the yellow. Now let's put this on the side. Now let's go to the blue. Again, always you start with the arm on the right hand. And the prongs have to be facing to the left. They cannot be facing down. They cannot be facing the up to the right. They have to be facing to the left. So now you hold the bite block with the left hand where the holes are, and you're going to insert the prongs from the right side. Like we said, all of them we're going to use this hole, not the multiple one. So we're going to use this one. And for this one, we're going to have it straight up. And now that bite block is right in the center of that ring. We're going to get the mouth and we will expose anterior teeth, which is the canine. We're going to do centrals, and then we're going to do canine. We're gonna take it out. Gonna go down. So we had it up. So now we go down. No change, no nothing. Just flip it. And we're gonna do canine, lower right, lower left, centrals, and canine, lower right. And that's how we would do the blue. The blue is fairly easy. There is no change. You just do canine, centrals, canine, go down, canine, centrals, canine. And you would be done with the blue. Now how to assemble the red. The red is also simple. You're not going to be doing any changes. So hold the arm on your right hand. The prongs have to be looking where the bite block is. And always remember that I think I forgot to mention it with the blue. The area where the sensor goes always have to be facing away from you, never towards you. Always away from you. So when you hold it, the holes are here. So you're just going to put it there. And again, you're going to use this side of the hole to go through the arm. And it has to be where the bite block is. So if you have this like this, it's not gonna work because again, you're not exposing anything here. The tooth it's going to be here. So what do? You take it out and make sure that you put it through this hole and that bite block is in the center of that ring. And then how do you put it in the mouth? It's going to be molars. And for you to open the spaces, because with this one we check interproximal cavities, you cannot place it like this. You see here is not how the arch goes. So in order for you to open the spaces, when you place it in, you're going to tell the patient to close the mouth. And at the same time, you're going to be angulating the bite block right where that arch is. So when you expose it, these spaces are going to open. So you're going to do the molars, then you're going to slide it at an angle, and you're going to do the premolars. And the patient is going to open. Take it out and then you just flip to the other side. So now you're going to do remolars and then the molar shot. And that's how you use the red one. So now we know how to assemble each one of them. But now I would like to go over, just in case if you go to an office that these prongs have lost their color, or maybe some of the rings, instead of being blue, red, yellow, it's black. In order to identify these arms and rings, I'm going to show you something. Posterior teeth are wider. So because of the width of the teeth, the x-rays that we're going to take, it is best if we take it in a horizontal way. So everything will be horizontal because the teeth are wider compared to anterior teeth that are longer. See, teeth in the front are longer and teeth in the back are wider. So look how the arms look. For the back, when we hold it in the right hand and the prongs are facing this way, this arm looks horizontal. Because the teeth are wider, they're going to be horizontal. Now let's see this arm here. When we hold the arm and the prongs are facing the left, look how the arm is vertical because the teeth are longer. So this is a way to identify which one is which, just in case these have faded. The colors of the arms have faded. So when you hold it and the prongs are facing this way, and this is vertical, it's going to be for anterior teeth because teeth in the front are longer. And if you hold this one and the prongs are facing that way, and this is horizontal, then you're going to know, even if this one doesn't have that color, you're going to know that this is going to be for posterior yellow. Okay? For the red is easy to identify because it's just straight with the prongs coming out from the straight arm. There is no curve. There is no curve like these two. Okay? It is just straight. And you would know this one is for the bitewing. So now, for the rings. For the red and blue, they are exactly the same. So there is a ring and it has this little thing that comes straight down in the middle. And this one is the same, the ring with this straight down in the middle. So if I assemble this, I could actually use the red with this. And look, it is straight in the middle because it's exactly the same ring. The same for this, I could use the blue. It is straight in the middle because it is exactly the same ring, right? So now, let's see the yellow. What is the difference with the yellow? The yellow is not in the center. It is shorter and it's like diagonal a little bit. If I put it like this and like this, you're going to see that this one is straight down and this one is a little bit short and slanted. So then you would identify that this one is the yellow and this one is the blue or the red. Okay? So that's how you would identify these colors, just in case they faded or they are black, because you could find different things in different offices. So now let's go on how we are going to position the sensor. So for the posterior, because we mentioned that they are wider, the sensor will always go horizontally. Besides going horizontally, we have to know that the wire also goes with the arm. So we do, and the flat surface always goes with this area that is flat. The bite block has an elastic. You see this? It's always going to be on top. So the way to do it is we're going to go and put the sensor in there and move that elastic so it can fit in there. Okay? Horizontally, the wire with the arm. If we have the wire this way and the arm this way, look what's going to happen in the mouth. When we go in, we're going to be putting this wire in the mouth. And that's not going to be fun for the patient. So we take it out. Flat with flat. And the sensor will always go with the arm. Okay? And the posterior will always be horizontal. Okay? So now, for the anterior. For the anterior, it's going to be vertical. So we're going to place it straight up. Again, this part moves so we can fit it in. So we're going to move it and we're going to fit it in. And the wire with the arm. The wire goes with the arm. Okay? So we cannot have it like this, because the wire is this way and the arm is this way, right? So we're going to change it and we're going to place it wire with the arm. Okay. Now we're going to do the bitewing. It's going to be horizontal because again we're taking the posterior teeth, so this cannot be vertical, right? It has to be horizontal. So we're gonna move this and it's going to be here and again the wire where the arm goes. We cannot have this one here and the arm here. Okay, and we're going to change it horizontal. So the only one that is vertical is the anterior blue. The bitewing and the yellow, the sensor will be placed horizontally and always in the direction of the arm. Okay? And that's how we assemble the XCP for the digital sensor.